Good morning. My name is Ratna Omidvar. I'm an independent senator from Ontario, and I'm here today with my colleague Senator Stan Kutcher from Nova Scotia and Senator Mohamed-Iqbasl Ravalia from Newfoundland and Labrador. We are here today to release our report titled Maximizing Medical Talent, How Canada Can Increase the Supply of Family Doctors by 50% quickly and cost-effectively. Canada is facing a primary care crisis. An alarming 6.5 million Canadians do not have access to a family doctor, a number that is projected to rise to 10 million within the next decade. We find ourselves lagging behind our international counterparts, ranking last among 10 high-income countries when it comes to access for primary care. This is not just a statistic. It is a clear call for action. And yet, our supply of doctors is nowhere near our demand. Currently, only about 1,500 residents complete their family medicine residencies each year. With the addition of the announced 5 new medical schools, this will bring our medical schools from 17 to 22. This holds promise for the future, but it does not adequately address it in a timely manner. According to the federal government, 4,000 additional family doctors are required today, and 78,000 doctors will be required by 2031. The first cohorts of these new medical schools will not graduate until the early 2030s, and even then, merely increasing the numbers of graduates will not suffice without a corresponding increase in residency positions. We will not see a fast influx of new family physicians into practice. The federal government, alongside with provincial and territorial partners, has been making efforts to tackle these changes. Budgets for 2023 and 2024 outline a significant investment of $200 billion aimed at improving healthcare for Canadians. However, despite this considerable funding, we still lack workable, timely solutions to address our immediate needs. In light of these challenges, our report offers 2 crucial solutions that will make a meaningful difference in the short, mid, and long term. The solutions tap into the talent of those Canadians who were trained overseas in medical schools, or those immigrants who came to Canada with medical degrees and even experience. And to be perfectly clear, we're talking about those in this cohort who have passed every test, every requirement, every hurdle to be practice ready. They have gone through the process of clearing the requirements for credential verification. They have completed the language tests. They've gone through the Medical Council of Canada qualifying exam and the National Assessment Collaborative Objective. So I said, every challenge, every test, every hurdle, all they require is a residency. But a mere 39% of this ready-to-serve pool are matched to residencies in the first round, and another mere 18% in the second. Think of the pool of talent lying fallow whilst Canadians go without family physicians. Finally, any conversation about healthcare wades into the murky waters of jurisdiction. And I think we all know what that may mean. More studies, more consultations, more reports, possibly no action. The 2 solutions my 2 colleagues will present lie squarely in the hands of one jurisdiction, and one jurisdiction alone, the federal government. They are therefore imminently practicable and doable. The federal government has the power and the resources to action them. And there are precedents that the federal government can look back to. It puts the federal government in the driver's seat so that finally Canadians will not have to wait for a family physician. We therefore call on the federal government to exercise the required leadership, and I would like to pass it over to my colleague, Senator Ravalia, to describe the first solution. Thank you.
Thank you and good morning. Thank you, Senator Omidvar, for your insightful and comprehensive overview of this important report. As an international medical graduate myself, I'm honored to stand before you today and speak about an issue that is both deeply personal to me and critically important to the future of healthcare across our country. Completing my medical degree in Rhodesia in 1980 and serving as a family physician in Newfoundland and Labrador for over 35 years has afforded me a unique perspective on the challenges and opportunities facing international grads in our healthcare system. For decades, IMGs have made an invaluable contribution to the Canadian healthcare landscape. They bring a wealth of knowledge, diverse experiences, and global perspectives that enrich the medical field and improve patient care across the country. However, as this report demonstrates, while their potential is immense, many highly qualified professionals continue to face significant barriers in their pursuit to practice medicine in Canada. Chief amongst these are the shortage of residency positions and limited access to practice-ready assessment programs. I'd like to take a moment to acknowledge the positive strides in the federal government's initiatives in addressing some of these issues. In recent budgets, we've seen, as Dr. Omidvar mentioned, the $200 billion towards improving healthcare access in Canada over the next 10 years. This investment does include efforts to support healthcare workforce planning. And it's important that these initiatives lay the groundwork for much-needed reform in our healthcare system, and they signal the government's recognition of the value and necessity of supporting healthcare professionals, including internationally trained physicians. Moreover, the government's collaboration with provinces and territories to increase residency spots marks a significant step in the right direction. By expanding pathways for both Canadian medical graduates and internationally trained physicians, this increase is helping to ease the pressure on our healthcare system. Yet, as we look ahead to the future, it is clear that more must be done to fully unlock the potential of IMGs and ensure Canadians have access to the healthcare they need. We are at a pivotal moment in Canadian healthcare, with nearly 6.5 million Canadians currently without a family doctor, a number expected to grow to 10 million within the next decade. The urgency of the issue cannot be overstated. Our proposal offers a clear and practical solution. Create 750 additional residency positions per year, specifically for internationally trained physicians. This is not merely a request, but an investment in the future of our healthcare system. With this modest but strategic investment, we can introduce 6,000 new family doctors into the system over the next decade, providing care to more than 9 million Canadians. These professionals are ready and eager to serve. They have already gone the rigorous training and met the Canadian standards. All that stands between them and their ability to contribute fully to access is residency training or the practice-ready assessment pathway. By opening these doors, we can make an immediate and profound impact, particularly in rural and remote communities where healthcare shortages are more acute. Today, we have an opportunity to take meaningful action. By expanding residency and practice-ready assessment programs, a topic that my colleague Senator Kutcher will elaborate on, we are not only supporting these talented doctors, but investing in the health and well-being of Canadians from coast to coast to coast. This is about creating a healthcare system that works for everyone, where no one is left behind, and where every community has access to the care they deserve. Let us continue to build on the progress that has been made with optimism and determination, work towards a healthcare future that is inclusive, innovative, and equipped to meet the need of all Canadians. Thank you.
Thank you, colleagues. Look, we have a problem, a big problem. We have solutions. The solutions aren't being applied. So it's time to apply the solutions. And the federal government, as my colleagues have said, can do that itself. The provinces and territories can participate should they choose to do so. I have had the privilege of being an Associate Dean of International Health at Dalhousie University, and from that vantage point, and my colleagues' vantage points, we see the terrible problem with physicians who have been trained in other countries coming here with their skill sets, can't use them. We've heard of one really good solution, increasing the residency programs, which can be done directly to medical schools. But there is another one, and it's called the Practice Ready Assessment, perhaps not as well known to Canadians. The Practice Ready Assessment is a route to licensure that experienced, that is, people who have already been practicing medicine in other countries, who are now permanent residents or even Canadian citizens, can be evaluated to determine that they have the necessary competencies for safe and effective medical practice in Canada. The PRA comprises an in-depth evaluation of the internationally trained physician's competencies, conducted under direct supervision by a trained physician assessor in a clinical setting for a period of 3 months. That's right, 3 months. We have highly experienced, well-trained physicians. They need an assessment period of 3 months, and then if they're successful, they can move forward into licensure. Upon completion of this assessment, the participant meets the same standards for licensure that a Canadian graduate must meet. Because the period is only 3 months, ramping up national capacity in physician-ready assessment has the potential to quickly graduate qualified and experienced physicians that will address the huge shortage of family physicians nationwide, and also, in some areas, specialty shortages, which are also nationwide, which we can't address currently. In fact, many graduates from PRA assessments sign return of service agreements that directs their practice into parts of Canada where the need is greatest, rural areas, for example. The PRA is the most cost-effective way to increase the pool of highly trained physicians who can meet the healthcare needs of Canadians. When done together with the increasing of residency positions, we can really make a difference rapidly and cost-effectively. However, the PRA, although it's a really good solution, has not been taken up as a national priority, or even within provinces. This lack of action is denying Canadians access to high-quality medical care, and at the same time is unfair to immigrant physicians who are now permanent residents or Canadian citizens who've often been recruited to Canada or attracted to Canada because they're physicians. This is a lose-lose situation. This is the doctors driving taxicabs situation. With a modest investment, the federal government can rapidly turn this lose-lose situation into a win-win situation. The federal government can do this. It can directly fund a national practice-ready assessment program so that the number of physicians who are experienced, who have passed every single test that they need to pass, can have their competencies assessed and be available for practice in Canada rapidly. Thank you.
We will now take questions on Zoom. If you have a question, please use the raise hand function. As usual, one question and one follow-up. Nous allons maintenant prendre les questions sur Zoom. Si vous avez une question, s'il vous plaît, utilisez la fonction main levée. Comme à l'habitude, une question et une question de suivi. Thank you. This concludes the press conference. Merci.
Thank you.
Thank
Wonderful.
you so much.